had heard about genetic counseling back in high school, but completely forgot about it. I felt like for students that were interested in health sciences, at least like as a senior in high school, it felt like you had to be pre-med or nursing. And I felt like I had to make a choice between those two. And then, as I got through college, I, started to realize that there were a lot more things that someone can do in healthcare. So, Jody was very helpful in helping me figure that out and kind of rediscovering genetic counseling. So, um, I was a global health major, graduated in 2020, and I'm now a licensed and certified genetic counselor for Innova Health System, which is the largest health system in Northern Virginia. We have several hospitals and um, probably, I don't even know how many genetic counselors we have, but probably in the range of like 15 to 20 across all the different specialties. So I'm just going to be talking about the career, and feel free to send questions in the chat if you have them. So let's see. So genetic counseling in a nutshell, we are allied health professionals, and we receive training in both medical genetics and in psychosocial counseling skills. So those are kind of the two main arenas where we do our studies and then kind of apply those in clinical settings for the most part. One of our main jobs in a clinical setting is to review family histories and draw pedigrees for patients, as those can often be helpful in diagnosis and figuring out if there's a genetic condition in a family. We support families who have genetic conditions. We facilitate genetic testing. That's probably, I would say, the majority of a clinical genetic counselor's job is kind of ordering and interpreting genetic test results. And then kind of just helping people understand. So there's a big education aspect too, because most people in the general public do not understand genetics and how it can impact their health. So part of our job is to kind of make it understandable. And those are I would say, the core things that genetic counselors are trained to do. But as you can see below that, there's lots of other roles that we can play, and other tasks that we do on a day-to-day basis, all depending on, what kind of job someone has in the field. So within genetic counseling, we can specialize just like physicians can specialize. What's cool about it, at least in my opinion, is that everyone receives the same general education and you can specialize in whatever you want from there. You do not need extra training to go into a specialty, and you can switch specialties whenever you want. So you can go in and be interested in cancer genetics. You can go straight into a cancer genetics job from school. And then if you change your mind and then you want to do prenatal genetics, you can switch to prenatal. You don't have to go back to school for more training. So it's a lot easier than like a physician to switch specialties. Those are, so the three big specialties for genetic counselors are prenatal genetics, cancer genetics, and pediatric or general genetics. So the biggest one now, which is kind of has shifted over the years. Right now, the biggest specialty in genetics is cancer, with prenatal and then general being below that. But then there's also a lot of emerging new specialties in the field as well, listed below those. So for myself, I have a more unique role. So inpatient is my primary role at Innova. And what that means is I see patients who are just born and are in the NICU. I see kiddos that are admitted in the PICU. I see adults that are admitted to the hospital. So people that are actually in the hospital, if they need genetic testing, I would be the one who's counseling them on that. Whereas other genetic counselors are typically on an outpatient basis. So they have a scheduled list of patients, whereas I am more on call. And the number of specialties is growing. There's more and more jobs that are kind of more niche, more specialized over the years. And then aside from the clinical side of seeing patients, there's also lots of non-clinical roles that genetic counselors can have. They can work at genetic testing labs. They can work in as faculty members at genetic counseling programs. They can work in public policy, public health, all kinds of different things, working for insurance companies. So there's lots of options outside of the clinical role as well. And even straight out of grad school, you can go into a non-clinical role. So really once you have your genetic counseling degree, you can pretty much go into whatever you want to do as long as you can find that job. So just to give you an idea of some of the common indications for genetic counseling, most people have never interacted with a genetic counselor, but there's a lot of different reasons that someone could be sent to genetics. So in the pediatric and general realm, it's a lot of things related to development in children. So developmental delays, autism spectrum, intellectual disability, and then some other features like deafness, um, growth issues, and then some other kind of health issues like seizures, diabetes in young children, et cetera. On the prenatal end, it's a lot of things where if there's an abnormality on an ultrasound, or if prenatal carrier screening or testing is showing a high risk for a genetic condition, or if someone has a pregnancy and they have a family history of a genetic condition and want to know more about the risk to their children. Cancer, we're talking about personal history of cancer or family history of certain types of cancer that are known to be associated with hereditary cancer syndromes. So breast cancer is a big one, colon cancer, and then there's other, rare hereditary cancer syndromes that can run in families and increase the risk. And then cardiogenetics is another large and growing specialty. So we have a big cardiogenetics center here at Inova. And so there's specific heart conditions that can run in families that tend to have genetic causes that can be tested for. So cardiomyopathies, arrhythmias, things like that. And then I think it's important to distinguish between medical geneticists who are physicians trained in genetics and genetic counselors, and some of the differences in between those roles, because many of you probably are pre-med or used to be pre-med. And so just kind of thinking about these two categories of healthcare professionals who go into genetics and what the differences are. So genetic counselors outnumber medical geneticists by a lot. There's a lot more of us. And so usually multiple genetic counselors are working under or with each medical geneticist. So at our clinic here, so we have cardiogenetics, prenatal, and general genetics kind of lumped together. And we have 2 geneticists and 6 genetic counselors in that group. So usually that's a pretty typical ratio, I would say. And the number of medical geneticists is not rising nearly as fast as the number of genetic counselors. So our field is growing a lot faster because we have more training programs, and it's a shorter course of education. And that number, the 6,500 is low. I think it's a lot higher than that now, but the main difference I would say between these is the amount of time you're in school. So for a medical geneticist, you're getting an MD, and then you have to do a residency, which can be in pediatrics usually, but some people would do internal medicine, or there's other specialties that you could do, and then a genetics fellowship. So this is going to total 9 to 11 years after undergrad, whereas genetic counseling is 2 years after undergrad. I think it ranges like 18 months to 2.5 years. So it's pretty short, and it's a master's degree. There is no PhD or doctorate level degree in genetic counseling at this time. They've talked about that, about making that a thing, but it's not at this point. Medical geneticists are really going to be specializing in general genetics and pediatric genetics. Medical geneticists are not generally involved in cancer or prenatal genetics. So those specialties are really run by genetic counselors and other physicians. So in prenatal, it's genetic counselors working with a maternal fetal medicine physician. And then in cancer, they would be working with an oncologist or surgeon. Medical geneticists are trained to do physical exams and also to provide or prescribe medications, whereas genetic counselors are not. We are more so, again, trained in education, translating complex genetic information into something that's understandable to patients and the general population, and counseling patients if they're experiencing emotional reactions to this kind of information. Both geneticists and genetic counselors can see patients independently. So we're able to, genetic counselors can see patients by themselves, write their own notes. We can order genetic testing and diagnose genetic conditions, and we work together. If there is a geneticist in the genetics clinic, we always work together to care for patients. So in my adult clinic, I see patients, I sit next to a medical geneticist and we see patients together the entire time. I would focus on family history, kind of counseling about what this genetic testing is, whereas she's more focused on the medical history, making sure that's documented and that kind of thing. So we complement each other in the session. So in a typical genetic counseling appointment, there's a couple of different elements that we usually have. So taking that family history, teaching basic genetic principles, talking about chromosomes, DNA, mutations, explaining inheritance patterns if that's relevant, giving patients information about testing options. Genetic testing is always optional. So this is something that we always talk to patients before we order something. Whereas in other areas of medicine, a lot of times the physician will order a bunch of things and they're not necessarily going to tell you exactly what blood work they're ordering and what exactly they're looking for. But with genetics, we are specific about that and we have to get consent for any genetic test that's ordered. And it has to be specific and involve, teaching before we're able to get informed consent for tests. So we go through a whole decision-making process. We talk about laws that impact genetic testing, such as GINA, the Genetic Information Non-Discrimination Act, and other things like that. We work really closely with genetic testing labs and insurance companies to make sure we're getting our patients affordable testing, because that's also really important. People aren't going to choose an optional test if they don't know how much it's going to cost or if it's going to be unaffordable. And then we provide resources. So if we get a diagnosis, we're able to kind of disseminate resources, websites, books, support groups, Facebook groups, all that kind of stuff would fall into my role, to make sure people understand information and they're able to connect with potentially other affected individuals or other families that could be going through a similar thing. And then just providing psychosocial support. Sometimes we do testing that is really impactful for a person's mental health. And so it's important for us to keep that in mind, talk about mental health, talk about therapy and what we can do. I will clarify that we are not therapists, even though counselor is in our name. We are not designed to actually provide therapy to patients. We would refer out for that, but we're able to kind of handle things in the moment as it relates to a genetic condition. So how does someone become a genetic counselor? There are a bunch of prerequisites, and these differ between different genetic counseling programs. You do need a bachelor's degree, which you're all on your way to getting. So that is the first one. It can be in any major. So I was global health, which had more of a public health focus and did not really have required coursework in the hard sciences. But you do need that coursework in hard sciences in order to qualify to apply to a program. And the number of years or semesters you need in each of these courses varies based on the program. Some programs do require organic chemistry. Not sure if any of you are wondering about that. You might be in organic chemistry right now. But the program I ended up going to, and all the programs that I applied to did not require it. So I did not take organic chemistry, which was a big bonus. Um, all the programs require that you have some kind of exposure to genetic counseling. This talk counts as exposure. So any kind of exposure is valued because there aren't that many genetic counselors, so it can be hard to get things like shadowing. I will say Inova does offer shadowing. So if you're really interested in this field, we can make that work. And you'll have my contact information if you would like to set something like that up. But it can be hard, especially for people that might live in an area that doesn't have a lot of genetics counselors or genetics centers. So things like informational interviews are also a great way to get exposure. All programs require some kind of counseling or advocacy experience. Most people do the crisis text line or some kind of crisis hotline, but also working with marginalized groups or working with people with disabilities is another great way to get that kind of experience. Then, as with other grad programs, letters of recommendation, personal statements, other essays are required. And then optional, the GRE, I think this is going away. I had to take the GRE when I applied in 2021, but I'm pretty sure that almost no programs are requiring it now. So I'm not sure exactly where that stands, but you might have to take the GRE. Research is great to have. I did not have much research going in. That was like not something that I really had in my background, but that's something a lot of people do come in with. That's helpful. And then any work experience that's relevant. A lot of people after undergrad, if they're not quite ready to apply, they need some more time to either get prerequisites done or get their volunteer crisis counseling experience done. They'll take a gap year and might get a job as a genetic counseling assistant. So that's what I did. I went to work at CHOP at the Children's Hospital of Philadelphia as a genetic counseling assistant. And so there I worked with a team of genetic counselors and neurologists who specialized in neurogenetics. And I got some amazing exposure to the field, but that is not required. It's just a really good, if you're going to take a gap year, it's a really good type of job to have just to get that exposure. On the right, these are all of the places that I went to get my experience. So James House was a local crisis hotline that I volunteered with. And then I did some shadowing at Columbia they have a pre-genetic counseling program for people to shadow for a couple days up in New York. And then I also shadowed at the Children's Hospital of Richmond. Um, and then I took some of my prerequisites that I did not finish during undergrad. I took those through a local community college, and that was really nice. And they don't mind if you do that. That is absolutely acceptable. You do not have to do all of your prerequisite coursework at Georgetown. I know for myself, I really struggled with chemistry. And when I took it at Georgetown, I had to withdraw because it was not going well. And then I took it at community college and did not have a problem. So no shame in doing that either. And then, of course, my gap year, I worked partly in person, and then for half the year I was remote. And during the process, or during my gap year, I was going through the application process and ended up at the University of South Carolina School of Medicine, which has a genetic counseling program within it. So the application process is a match. So if you've heard of or familiar with the physician residency match, it is pretty much the same process. So there's a bunch of programs in the US and Canada that all participate in the match. It is required to participate in the match. You cannot apply to a program outside of the match system. Most programs only have 8 to 12 students per class, so they're really small programs, but the number of programs is increasing every year. There's like 1 to 2 new programs. So the timeline looks like in the fall, you apply to the match and you apply to each individual program. Then they review your application and determine if you're going to be invited for an interview. The interviews happen between January and March. For all the programs that you interview at, you rank the programs, and each program typically has multiple tracks. So those would be things like scholarships, fellowships, other things that you may or may not be interested in or qualify for. So you have to rank all of the tracks in order of preference in April. And then on April 17th, or I don't know what date it'll be next year, it's match day, and you get an email that says either you did not match and try again next year, or you get an email that says, here's where you're going, and it is binding. So if you rank a track, you have to be willing to accept it. This process was implemented, I think, 2 years before I applied. And while it seems maybe difficult or intimidating, I do think it's helpful and better than the typical application process just because each program is so small. It used to cause a lot of problems before they had the match. So this is something that you have to really be committed to when you do apply. And if you are ranking any programs, it is binding. So this is a map of all the different programs. There are several, a lot on the East Coast and pretty much all over the US. And then once you get to school, the curriculum, varies, but for the most part, in the first year, you're doing a lot of coursework, sitting in a classroom, listening to lectures, learning about medical genetics, developmental biology, and then those counseling skills as well. And then we have, smaller classes that are more focused on specific topics like cancer genetics. And then we do, a journal club, case conference. Pretty much every program has this similar setup. And then in the second year, it's more focused on field work. So you'll still have some coursework, some classes that you go to, but for the most part, you're in genetics clinics in your area. And you do different rotations. So for my first rotation, which is the summer rotation, I was here in DC at Children's National Hospital. And then back at school in the second year, I was all over South Carolina doing different rotations because for our program, Columbia, where our program is held, is in the middle of the state. And so we would travel to Charleston, Greenville, Greenwood, all over Charlotte, North Carolina to get our rotations done. We also have a thesis requirement. Not every program has this as a requirement, but most of them do. And so you do original research and write a manuscript, mostly on the topic of your choice, but some programs that varies. And then there's also community outreach, volunteering, just getting involved in the local community. And that's also a big part of the program is just kind of integrating yourself and preparing to go into the field and being willing to get to know the community around you, especially as it relates to different genetic conditions. So things like a Down syndrome buddy walk or something like that would be expected. So these are just some stats from the last professional status survey. I think this might not be the most up-to-date information, but it's not too bad. So overall, about half of genetic counselors work in direct patient care. And then the other half are going to have either a mixed position or not work in direct patient care. And starting salaries and overall average salaries are rising, thankfully. But it's not too bad. But they are going up every year, which is good. And then for the bottom right, so most states have genetic counselor licensure, which means that states are regulating who can call themselves a genetic counselor and who can practice as a genetic counselor with different requirements. So for example, there is a genetic counseling board exam that everyone has to take in order to become certified. You do that after you've graduated from your program. And Virginia does have licensure, so I'm licensed in the state of Virginia, but other states haven't yet enacted licensure. So this kind of just shows the states that do have licensure and how many genetic counselors are practicing in each state. There are obviously genetic counselors in these other states like North and South Carolina. They're just not officially licensed, but they're still certified genetic counselors who've taken the board exam. South Carolina actually just got licensure this year. And while I was at the program, I was able to go to some congressional hearings and other kinds of events related to that. So that was really cool, and just kind of advocating for our profession to be recognized and licensed in the state. Um, yeah, so that is pretty much everything. This is my email address. If anyone wants to reach out about potentially shadowing, we do have opportunities throughout the year. We have a lot of students right now, but we would be happy to accommodate if anyone is really planning on being a genetic counselor or going down this path. We have a mentorship program for potential applicants. And so that involves just one monthly Zoom meeting where we do things like CV reviewing, or we have like mock genetic counseling sessions that you can observe. And that's another really great way to get exposure to the field. So we try to make that accessible, and all of that kind of exposure more accessible, at least to people who are planning on pursuing genetic counseling as a profession. So feel free to reach out and I will connect you with the right people if that describes you. But otherwise, happy to take any questions.
Wow,
Can stop
thank
sharing
you,
my screen.
Olivia. That was amazing. You've answered all my questions that I have almost. So I have one if others don't, but I was even going to ask you about starting salary. So great job. Thank you so much for sharing all that. It was really
Yeah.
helpful. Does anybody have any questions? I guess a question of mine, but I think I might know the answer. Is just, you were trying to figure out if this was for you. Was there something that you felt like was the most impactful in helping you just make the decision, like, yes, this is what I want to do? Because it's not a pre-med commitment, medical school, but it's certainly a big commitment to pursue this. So I'm just wondering if there's anything that was particularly impactful for you in your journey.
Yeah, that's a great question. I think for me, when we talked about it, I immediately thought about how interesting I found my genetics classes. So I was
Mhm.
lucky enough to take a genetics course in high school where it was a full year of genetics. And my teacher in high school talked about genetic counseling and said, this is an up and coming field. Everyone should go into this field if you like genetics, if you're in this class. And we did a project in that class where we kind of had like a mock patient who we followed throughout the lifespan and kind of talked about, a patient with this condition, what does it look like at different stages in life? And I loved that project. So whenever it was brought up again, I was like, ooh, yes, genetics has always been the thing that interested me most about medicine and the healthcare field in general. I always thought genetic conditions were so interesting. I always wanted to learn more about them. And there are so many genetic conditions, you can never know all of them. So I think for me, it was just more like an academic interest in genetics that kind of made me think this was the right field for me. Um,
Yeah, that makes sense. That intellectual curiosity was really.
exactly. Yeah. And just, I did not love learning about like mitosis and meiosis. Like that kind of stuff did not really interest me. And I even like I got worried because I did not enjoy chemistry, did not want to take organic, did not want to do physics. Like I did not have to do physics. No program requires physics, so that's a good thing too. But I was not really a hard science person. Definitely would not have majored in bio, even if the global health major didn't exist. So I wasn't really into hard sciences, but it turns out that wasn't really all that important.
Yeah.
Um, More so just the ability to understand genetics, and then really in training you're learning about the nitty gritty stuff, but you're also really focusing on how do I make this sound simple, and how do I chisel this down into something that patients can understand and can provide informed consent based on that information. So um, I think it was more so like an intellectual curiosity, and just knowing that it's a growing field. There's jobs, there's good salaries, job security, that kind of thing was also really important to me.
Yeah, that makes sense. Well, Sam has a question here. So let's get Sam's, and then great Caroline has a question after that. What does your day-to-day look like?
Yeah, so and this is gonna be really different for everyone. I feel like my job is weird and probably not similar to everyone else. So I sit here in this office in the hospital. 2 floors above this office is our NICU. We have a huge NICU here at Inova Fairfax. It's one of the largest in the country. And so every day I come in wondering what I'm going to see next. So we will get consults. So I'll either get a phone call, I have a pager, we'll get a page, or I'll get a message in our electronic medical record that says, hey, this baby was born and has these symptoms or these birth defects, and they need genetic testing. So then I would, whatever consults come in, I would, go upstairs, talk to families, talk to the doctors who ordered the consult, work with the geneticist as well to get the testing ordered, get make sure samples are sent out correctly, and then also monitor for results coming back, seeing have we gotten any results, were they normal, were they abnormal, calling families if they've left the hospital or going back upstairs to talk to them if they're still here, explaining that stuff, looking for resources related to what we found. Like for example, today we had 7 consults today, and normally we have 5 per week. So it was a very busy day. But there was, for example, a baby who was born and had facial features of Down syndrome. And there was also, during the pregnancy, the mom had a screening test that found a high risk for Down syndrome. So today I went up and talked to the mom about, I showed her a picture of chromosomes because she hadn't really gotten good counseling prenatally. So I kind of talked to her about what Down syndrome is, how there's an extra chromosome, and then how we can look for that extra chromosome with the cord blood that was connected at the or collected at the delivery. And so I kind of then coordinated with the nurse to give her the paperwork she needs to send that off. And then in about a week, I'll call her and tell her if the baby has Down syndrome or not. I also brought her a book in Spanish. She's Spanish speaking. So I brought her a book in Spanish about Down syndrome, some Spanish resources that I've put together in the last year. So things like the Northern Virginia Down Syndrome Association, and other things like, I don't know if you guys have been to Biddy and Bo's on M Street, which is a coffee shop that's run by people with disabilities, including Down syndrome. And so I always tell people about Biddy and Bo's too, and just kind of, give people resources that they might find helpful. Most genetic counselors are not going to go up into the NICU. That's my role, which is kind of a rare specialty to have. Most GCs would be spending 2 to 3 days a week seeing clinic patients. So they would be either virtual patients or in person at a clinic and scheduled. And so that would look like, seeing patients maybe at 9, 10, 11, 12, and 1, and then spending the rest of the day writing notes, placing orders for genetic testing, and calling out results. And then admin days would be spent prepping for the next week of patients and again, calling out results, gathering resources, and that kind of thing. And then troubleshooting if there's any issues with samples in the lab or anything like that. So that's kind of what my day-to-day looked like. Today I had 6 adult virtual patients on my schedule and then 7 consults in the hospital. So it was a long day and I will be here for a while after this. But for the most part, I work 40 hours a week. It's not crazy hours like residents would have, for example. Today was an exception to that. But yeah, for the most part, it's kind of that mixture of seeing patients, direct face-to-face contact with patients, and then kind of doing the back-end logistical stuff.
Wow, that's a lot for today. Thank you for again for doing this presentation for us. Caroline has a question.
Hi, I just wanted to ask if you had any recommendations for jobs or like summer internships that you think would be good for this kind of experience aside from genetic counseling assistance.
Yeah, so I think a lot of people would, other than being a genetic counseling assistant, so being a research assistant, honestly, even if the research is not related to genetics, that could be helpful. that it's really common for people to come in with research experience because there's a lot of research assistant jobs, and things along those lines. So that's a common one. For summer internships, I did a couple of public health ones. So like I interned with the Virginia Department of Health, and I think it was like a rural health initiative or something like that. Again, doesn't have to be genetics related. I think anything that focuses on health disparities is a really good thing to have under your belt, because that's something we're trying to address in every field of medicine, but definitely in genetics, there's a lot of disparities. And so any kind of internship related to that would be helpful. Um, and then anything that involves working with people with disabilities. So, like working at a summer camp for people with disabilities would be awesome. I know of some people that worked at shelters or domestic violence hotlines, domestic violence shelters, really anything involving marginalized groups, people with chronic illnesses, people with disabilities, all of these things would be great experience. And there's no one right way to do it. I think nowadays, the admissions process is getting more competitive as more people learn about genetic counseling, and it's really helpful to stand out. So, whatever interests you about the field, if you are really interested in cardiogenetics and heart conditions, and you find some kind of internship with the American Heart Association or a camp for kids with heart defects, that would be awesome. Even if it's really specific and maybe not genetic related, I think anything like that that um, makes you stand out, that makes you have, a unique background going into school is helpful.
That was really useful
Thank
advice.
you.
Thank you, Olivia. And I think it's so neat that Inova offers a shadowing. I had no idea about that, and I'm definitely going to recommend that to students. Maya has a question about that. She says, is there a certain minimum age or grade to apply for a shadowing position?
I don't know the answer to that. Our program is pretty flexible. I would say the requirement, so we like for all of our shadows to first join our mentorship program. And so I would say the main requirement wouldn't be age related, but it would be more so like how sure are you that this is what you want to do? So if you're still exploring a lot of different healthcare careers, it might not be the best time for shadowing, at least here. You might be able to find other shadowing opportunities, but ours is focused on undergraduates and then people who are out of college, but maybe in another field, who are, planning on applying. So if you are maybe, a freshman or a sophomore, but you're like, oh, I'm definitely applying when I'm a senior, or I want to be a genetic counseling assistant after I graduate, I think that you could probably shadow, but I wouldn't make any promises on that. It's up to one of our senior genetic counselors who kind of makes the schedule and everything. And I think it also depends on how many people are reaching out for shadowing opportunities. So that would be something if you do your more research and you decide this is what you want to do and you're able to kind of express that, then that would probably be an option for you.